at that. Now I'm giving myself enough space to walk around. I'm not walking all directly on it. Now, grab here. Pull down. Alright? What's the next thing that I open up?
Ring stand.
Ring stand. Now I can turn this around. Alright? Can I walk in between here?
No.
So I come this way, right?
Yeah.
Turn it around. And I can pull it this way. What's the next thing I need to open up? My mail?
Your glove, your gown, and you
What on my mail? That's
open your gown and flip your gloves.
Now you see how these wrappers are a little bit smaller than the ones that you normally see that y'all have, those big wrappers that y'all have. This is actually what y'all gonna have.
Sorry, here.
Okay, what do I do?
That's too small.
Okay.
Flip my gloves. That's done.
Sorry.
Now,
Okay.
the next thing is either you can do this before you scrub, open up the instrument, or you can wait and let your circulator do it. Okay? Now, I normally do it because the circulator is doing other things. They're getting their the chart ready, they're interviewing the patient. So I'll give myself enough space so I don't contaminate, and then I'll pop it open, and I lift up. I don't drag it across because those edges are not sterile. So when I lift up this container, I'll lift up the lid and flip it back towards me. Okay? Inside of here, you're going to have a little blue filter, which we don't have. Y'all should make sure that y'all have those blue filters that's on the very top. That's going to let you know that it is sterile. Okay? And also you can possibly glance inside and see if there's a sterile indicator in there. I'm going to show you how that is. Now, once I've done that, what's my next step? Am I sterile?
Scrub.
I'm not sterile yet, okay? So now, I cannot touch anything that is sterile, okay? So now I'll come here, and now begin to scrub. Coming into the oil, where can I pass? Can I pass in between here?
No.
Okay, good. Come around here. Can I let water drop on this field?
No.
Nowhere. Not even on the wrapper. So I'll grab it. Dry my hands. Now, y'all going to see that in some of these gown sets they have 2 towels. That's in there. That's one for each hand. Each arm that you're going to dry. So that's done. Now, did you see me wait for my circulator to come and get the towel? No, you don't have to wait for your circulator to come and get the towel. You didn't see me touch or grab or do anything to touch anything that wasn't sterile. See, I normally do that, just drop it. Now, what's my next step? Wrap the gown. I can only touch the gown. I can't touch the gloves or the inside wrapper. You don't see anything?
No.
Any white?
No.
No. That's what you want, okay? What hand do I glove first?
Right.
See how I did that? Inch. I should know that by now because you've been practicing, all right? Face down. Crawl all the way under. Thumbs as well. You see? Can you see my thumbs? You see that?
Yeah.
Okay. Come out. pinch again right here. Come across. Now, do you see me sticking my thumb underneath here? No. Always on top. I'm going to give you some little girl gloves.
Just a 7.5?
That's because you have delicate hands.
Oh no, I have manly hands. Pretty big, in fact. But anyway, there you go. So now, look, watch how it's. Hand this to Miss Palmer. See, I'm holding this string. Y'all sometimes forgetting y'all let that drop. You cannot let it drop. You hold on to it, pull it apart, and look what I'm handing her. Well, she's grabbing the blue part. Now, Palmer's going to come towards me. I grab it, and I tie it. What's my next step?
Drape your mayo.
Drape the mayo stand. How simple is that? Can you see this? Come here, get my foot on it. Now that I'm sterile, look what I can do. Don't worry, y'all gonna get there too. No problem. Thank you, ma'am. How many people make their beds in the morning? Oh yeah, y'all clearing y'all throats now, huh? Ooh. Not sure, Mr. Goody. I just throw those sheets. Okay. Go ahead on, Farmer. Do your thing. I'm trying not to walk in. Great. Now, what do I normally do with this? Simple. Say I'm kind of average and see where the center of this is, so I have an average of where everything is. Now that I have that, what I normally do, start pulling it out, and I see where my edges are. Not all cockeyed. Now, do you see my hands going below the tabletop? No. Staying at the tabletop. Just like that. Okay? I don't like this, so can my circulator just kind of pull on that and go real nice and neat? I'll hold this right here. I got time. Can you get that other side for me too, please? Thank you, man. Good job. Now, what do I need to do after I do this? After that back table, look. So that means my circulator can't, accidentally walk into my space. Correct? Grab this, put it here.
Palmer, what is that you're giving?
She gave
Suture.
Suture, okay.
Keep him from walking so far from his sterile field. Notice where I'm grabbing this ring stand, I'm not holding the tray at the top, so that he doesn't have to walk so far out of his sterile field to receive his instruments.
Terrific. Thank you, ma'am. Yourself some room, because I'm going to be adding some other things to this. Other than so y'all cool so far? Understand that? Thank you, ma'am. Now, what do I need to do? Make a roll towel. Put it where? In the center of the table. You're going to see why we say it in the center of the table in just a minute. does this roll towel go in the mail? You want to open end, not on this end, but on this end. See right here, that's where the bore is. You go opposite of that, that's where the roll towel goes. Now my next step is to grab my instruments, come in here, making sure that my gloves or anything doesn't touch any part of the outside of the rim of this case. Understand? So I'm only grabbing the sterile container inside. Lift straight up, come here, place it on my back table. Now, I do have a count sheet, and I have to give this to my circulator. Look at the distance between she and I. Y'all see that, how far we are from each other? So she doesn't contaminate accidentally. Now, these are the instruments that you've learned with Miss Chris. I grab them and I place them on the roll towel. I'm going to move this basket so y'all can see. Because that frustrates me when I see y'all doing this. This is a roll towel. Look at it right here. See how this is? This is why y'all make the roll towel. Where the rings of the instruments go, not on top of the roll towel, but this way. That's so whenever I take out this part right here, see how all my instrument stays in line, intact? That's why you have the roll towel. Okay? Now, place this back right here. I'll be able to let y'all come back and see all the other things. Here you go. Y'all see this, y'all want to come up here and take a look at all what's up here. Don't have to remember that I have to do.
You have to remember.
Can't do like we do.
At work.
Like we do it. We're trying to teach y'all something. Y'all gonna adapt that once y'all start scrubbing. Guys, y'all can take these things off if you want. The Palmer takes everything out of the pan. Everything. And she have a cluttered table. Which kind of drives Mrs. Goody crazy, huh? Because I'm what? Oh, y'all shouldn't have said that. Y'all have an exam coming up pretty soon. Now, y'all know how to put this together? Did Miss Chris show y'all how to put together the Velcro? Oh, we're going to see how well you know how to put that together. Oh, yeah. I have to get Miss Chris in here to...
Okay.
I'm not going to say nothing since y'all see y'all know how to put it together. We're about to see. Okay. Now I think I'm ready to count with my circulator.
Miss Field,
Be my
I
circulator.
wanted to take a picture with you that close to my sterile field, because you're trying to teach you a margin of safety. I thought you said you was ready.
I'm ready. I'm waiting on you.
Perforating towel clamps.
No. Okay, perforating towel clamps. Now, what you want to count first, guys, whether you're gonna count instruments or what they call it, that soft count is counting your sponges like y'all learned with the Linux setup. It doesn't matter. But once you start counting instruments, you count all of the instruments. You don't stop in between counting the instruments and then start counting the soft count, okay? So let's see. Perforating towel clips. I have 1, 2,
Non-perforating,
1, 2,
curved hemostats,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
straight,
1, 2, 3, 4.
Alice's,
1, 2, 3, 4.
medium Alice's,
1, 2, 3, 4.
Munions,
1, 2, 3, 4.
Babcock,
1, 2.
Ochsner's,
1, 2, 3, 4, 5, 6.
Kelly's,
1, 2, 3, 4, 5, 6.
ring forceps,
1, 2.
needle holders.
1, 2, 3, 4, 5, 6.
Okay, we're gonna do sharps, scissors,
Scissors. Okay. I have 1 curved Mayo, 1 Metzenbaum, 1 straight Mayo.
Okay.
I have 1 long Metzenbaum and 1 long curved Mayo.
okay, knife handles,
I have 2 number 3s, 1 number 4.
okay, retractors, Parkers,
I have 1, 2.
Jelpies,
1, 2,
wheat lanterners,
1.
brakes,
I have 1, 2,
Army navies,
1, 2.
okay, pooled abdominal tip with guard,
Pull down on the tip with cord. See, 2 pieces.
okay, tissue forceps,
Okay, tissue forceps.
planes,
Planes, I have 1 small, 1 medium.
Russian,
1 small, 1 medium.
Ratu,
1 small, 1 medium.
Adsons,
1, 2.
DeBakey's,
I have 1 small, 1 medium.
Ferris Smith.
1. Now, you heard Miss Palmer say Adsons. And you should make sure you say Adsons with T. All right? 1, 2.
Okay, retractors, Harrington,
I have Harrington, 1.
Devers,
I have 1 wide, 1 narrow.
Richardson,
I have 1 medium, 1 large.
Valuables,
I have 1 wide, 1 narrow.
okay, Balfour,
I have 1 wing nut, 1 side arm, 1, 2 body wall blades.
okay, bladder blade,
1.
okay, that's our instrument.
Okay. Now, I'm going to count with the things that you know.
What you counting?
Ratex, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, somebody in here was counting real low the last time. I want to make sure that y'all count loud enough so the circulator can hear. Laps, I have 1, 2, 3, 4, 5. Laps, 1, 2, 3, 4, 5.
Y'all notice he did not stack those second 5 on top as he was counting. 1, 2, 3, 4, 5.
Okay. Blades, I have 2 number 10s and 1 number 15.
Okay,
Needles, I have 1, 2.
okay,
You see, I'm counting the needle itself. How many needles I have. Not worrying about the size, what brand it is, or anything. Just counting the needle. 1, 2.
what else do we do? Yeah.
Oh, yeah. I'm sorry.
No?
Bobby tip, 1. Scratch pad, 1.
Thank you, sir.
Now, let's put this together.
please?
I have some
Could you
gloves
take this,
already.
please?
I have some gloves,
Could you
but
take this?
who's the surgeon? Okay. That's what you let them do?
Yeah.
That's it, okay. Now, y'all know how to make a sponge stick?
Yes.
Oh,
They said yes, huh?
Yes. Okay, good.
we shall see. I'm gonna say my prayers early. And y'all say that y'all do. You're gonna have to let Miss Chris come up in here and verify it and make sure that y'all do know how to make.
Well, we need your prayers. That's for sure.
Alright, there we go, an impatient doctor. Here we go. Y'all seen how I did that? Okay. So while she's drying her hand, I'm getting everything else ready. And Miss Chris showed y'all how to load a needle?
No.
Although the blade,
No. No.
Oh, we're in bad trouble now. But we're gonna show y'all how to do that. Don't worry about it. Miss Chris and I have different methods of doing this. Basically the same. Now, how do I open this up? I let it fall. No, you see me shaking and baking. Now, let her come through. Right there, stop there, and now kind of advance the sleeve a little bit without touching the cuff of that glove. What glove I do first?
Right.
Now look at this, guys. I see a lot of people trying to do this first because the cuff is there. Take the cuff out. See how this is? Take it out. Put your hands on the inside. The thumb should be facing who?
Her.
Surgeon. So I do this. Look how simple this is. All fingers covered, and now she's going to stick her right hand in. See that? That's it. Same thing with this one. You're going to assist. With this, same way. Okay? Now, she can either give it to me or she can give it to Miss Palmer. Either one. That's her preference. But since I'm still a little busy, she can find the circulator can take care of that. Now, with the blades, guys, please always use the needle holder to grab the blade, pull it out. Okay, now aim to the floor. There was aim to the floor.
That's right.
You see how this is? And it slides on and it clicks. Once you hear that click, it means, and you're always going to check it, make sure that it won't slip off. You see I'm pulling on it and it won't. The blade is on. Correct. Okay? Now, I'm going to show you again with a 15 blade. Grab the blade and listen. Y'all don't do this. Y'all put your hand down, relax, before you cut yourself or someone else. Take your time in taking it out. It's okay. Grab it. Now, this is what I want y'all to see. See what I'm grabbing since Miss Chris hasn't showed y'all that. This is the sharp edge of the blade. I'm grabbing it on the non-sharp end of the blade. Can y'all see this? Please take a picture of it. Catch my smile too. Can y'all see it?
you can see, bring it over this way.
I'm going to bring it this way so everybody can see it. Okay? You see I'm grabbing it? Alright. Now, I grab it this way. Oh, that's so nice that y'all can video this. So now y'all have proof. Now, you see this right here? Say they have a wide end and then there's a narrow end. On here, it should match the same way. See, I'm going to load it going sideways just like this so it can slide in. How do I know that I have it turned right? Let me take this off. You see this part right here? See how they have a slant there? Look at here. It shouldn't match. If it doesn't, if I was to try to load it the wrong way, and grab the sharp end of the blade, which you should never do. Look at that. Will that match?
That comes short on this side.
Okay. See right here? It doesn't match right here. Now, if I flip this over, just like this here, and make sure that y'all don't grab it and cover this part, because then you won't be able to slide it on. Okay? You always want to grab right here on the non-sharp edge with the needle holder, grabbing it, and now you can see how it would match. Slide it in.
You heard the
like
click?
that. Heard the click? Now it's on. Okay? So now, you place that right here. Now, I'm going to show y'all another little thing that we do to make sure that y'all don't have.
Do I need to give you another suture to show them how to needle?
Yeah, that's fine. You can do
I
another.
mean, since you loaded it already.
I can always take that off and reload it.
Okay. Well, you know how you try to show them what it's in the package and you put it on?
Oh yeah, that's fine.
So you want to thread the needle back through, you're going to give you a new one?
I'll thread this one through
Tell
so
me
we
what
don't
you
have
want
to
me
keep.
to do, sir.
He's
I got
threading
this
it
one
back
right
through.
here. Now, y'all don't do this because I don't want y'all to get stuck with the needle. Okay? Now, put this right here. And I'm going to show you how we normally load this. This right here is just for extra protection right here, where the blades are. Because once they cut the patient, we're always going to assume that that patient can have just about anything. Alright? Now, what Ms. Palmer was talking about is showing you guys how to load a needle. Alright? On here, you'll be able to see. On the very back of this, see how this kind of pushes back a little bit? Alright. When y'all are going to load a needle, what you normally do is go straight to it. See how my needle holder is? As Chris showed y'all how to hold the ring instrument, huh? Mm-hmm. Okay. Now, when you're going straight in. Alright? I'm going to turn this way so that they can see as well. Going straight in, just like this here. We can put it down and go like this here, straight down. So I'm going parallel to it, and I'm grabbing right here on the center. Now, I'll grab it, pull it out. This is plenty enough in order for the doctor to be able to suture, just like this here. If you load your needle this far back, it's too far back. He won't be able to get close enough to the tissue. That's why you always load it at the very tip, right here. And you're not going to load it all the way back to where the wedged in part of the suture is, needle on the needle. You kind of go 3/4 of the way to about right here so the doctor can suture. The reason why you won't do it all the way to the very end to where it's wedged in, when the doctor's going through tissue, this needle can bend, okay? But if you load it at least 3/4, maybe or halfway, about like this here, that needle has way more strength in order for the doctor to suture, where it won't bend. Make sense? Y'all gonna see that once y'all start scrubbing. Alright, now, this is how I place now, you don't see me placing the needle up this way, or trying to place it this way. What can happen when you go to reach for something?
Stick.
You can stick yourself. So, this needle tip is always facing what? Down. Look at the ring forceps on here. Oh, I'm trying to leave it like this here? No. Am I trying to put it like this here? How will it stay like that? It won't. It's constantly going to fall. So, put this flat down on the table and that needle tip facing down. This is facing down. This is if it's facing up. You're not going to have it facing up. It's going to be facing down this way. Okay? Other thing that you want to make sure that you don't do when you're loading the needle, do not take it out of the package. Because if you do take it out of the package, number one is, if that string falls below here, what happens? Well, that tip of that suture is contaminated. And you can't bring it back until you fill. But if you leave it on your fill like this here, then you get ready to reach for instruments, you get all tangled up. The other thing is, what size suture is this? Tell me that. Anybody know? What kind of suture is it?
2.20.
2 or what?
That's a silk. No, that's not silk.
That's
That's
it? You see, you can't tell. Nobody can tell. But listen, this is the only way that you can tell, by leaving it in the pack like it is right there. Right? So once you take it out, can you identify that suture?
No.
More than likely, you cannot. Okay? But you can, because if you leave it in the pack, when the doctor's ready for it, Miss Chris is going to show you how to pass the needles. Okay? Any questions about that? So let me cut this off so y'all don't, because I pulled it out already. Now, the other thing that we want to show you guys is the order of how things are. Now, this is what happens, and we didn't show that to the last class. This is what happens when they finish using the suture. This is why you have this book here. You're going to place it in here so it doesn't flop around and get off of your field. Okay? Any questions about that? All right. There's going to be a whole lot of things. I don't want to tell y'all everything about making sure you keep the packs, so in case it doesn't miscount or something with the needles, you can count your packs as well. All right. Now look at the order that things are. All right. First of all, you got to look at how the instruments are on the roll towel. What is Mr. Goody? OCD. That's A-OK. Like everything nice and sweet. Okay. Now, when you're looking at this here, that's going to be an order that Mr. Foreman and I are going to little rhyme that we normally give you all to memorize the order the way that instruments go. What you're going to see that you have is come see a muscle, bone, or knee surgery. Okay? All that stands for, not the towel clips. You're talking about the curved hemostat, straight, Alice, Munions, Babcocks, Ochsners, Kellys, and then you have your ring forceps. Alright, and then of course at the very end you have your needle holders and any extra scissors. Now,
Can you repeat the
when
way
you-
that you said it's memorized?
yeah, we're going to give that to you guys.
Okay.
Now the other thing is that I want y'all to see is look at the way that things are organized on the Mayo stand. Okay? Well, do you recognize this on the Mayo stand? Look at the order. The same order that it's here is going to go in the same order here. Just not as many instruments. You're going to have 4 curved hemostats, 2 of everything else, except for the Babcock. You only have 1, which I have no clue why Miss Palmer did that, but it's Miss Palmer and Miss Chris. All right? But anyway, this is what you're normally going to have, and of course, 1 sponge stick. Okay? So y'all see that? Now, other thing that you want to keep in mind, there's a lot of things. Look at the way that the instruments are facing. The tips of the instruments are facing where?
Mayo
The Mayo stand. The tip from the Mayo stand is facing which way?
The back
The back table. Okay? Now, do y'all see where the rings are on the table? They're not facing this way. The instrument's not facing this way. They're facing where? This way. Okay? Opposite of what you have here.